Hello everyone, welcome back to this channel. My name is Namatovu Hannah and I am the lead nutritionist at Acquire Nutrition Company. And as usual, we come to you with these nutrition tips. And today's topic is going to be constipation. That is because it is a common issue that presents a lot of the people that come to us. Yeah, so it is important that we talk about it. So what is constipation? When we talk about constipation, we are referring to difficulty in passing stool. And it is characterized by infrequent bowel movements. Sometimes you pass stool a very few number of times. In other words, less than 3 times a week. Yes. Or sometimes it is painful and you feel like there is obstruction or incomplete evacuation. When you go, you feel like you have not completed to empty the bowel. Yes, that is what constipation refers to. Also, the texture is important. If it is separate hard lumps, that is now severe constipation. Yes. If it is lumpy and sausage like, that is now mild constipation. Yes. But if it is soft blobs, that means you simply lack dietary fiber. Yes. So what are the causes of constipation? We have lifestyle causes such as diet. Yes, you do not consume enough water or fluids, you do not eat enough, you eat too little food. Sometimes it can also be because you postpone the urge to defecate. Sometimes your food does not contain dietary fiber. The food that you eat is not a source of fiber, you eat a lot of junk food. Yes, other times lack of exercise, abuse of these drugs that they give you. They are called laxatives. Those drugs that they give people when they have constipation, those drugs that cause diarrhea. Yes, when you overuse them, sometimes they do not work, and you find that a lot of the time, most of the time, actually 24/7, you are constipated. Also, iron and calcium supplements have constipation as a side effect. Yes. Yeah, so we can classify this constipation into two. We have primary constipation, which refers to constipation without an underlying cause. So what is this? It is sometimes there is normal transit, but you have hard stool. The stool is hard. The stool that you go to pass, it is really hard. Also, you feel bloated, like you feel like there is a lot of gas in your tummy, or you feel difficulty, there is perceived difficulty to pass through, but there is normal movement. You feel like it can move, but you feel like it is hard, and also you feel pain. Now that is part of primary constipation because there is no underlying cause. Yes, sometimes there is slow transit. There is movement, but it is slow. Yes. When there is normal transit, we encourage that you just include dietary fiber in your diet because fiber increases motility. It increases the movement. Yeah, so because it is an osmotic agent, it absorbs water from the rest of the body, and the water is mobilized to come into the stool, and it increases the bulk such that the stool softens a bit and it moves. Yeah, if there is slow transit, there is movement, but it is really slow, we recommend that you use a mild laxative or an aggressive laxative. Actually, here we recommend an aggressive laxative, those drugs that cause diarrhea. Yes, sometimes there is an erectile dysfunction where the rectal muscles are impaired. Yes, sometimes sensation is impaired. It has been compromised because of one reason or another. People, you have your reason. We shall not go into them. Yeah, sometimes there is decreased pressure. The stool is in there, but you do not feel the pressure. So sensation is compromised. Yeah, that is primary constipation. Secondary constipation is when there is an underlying cause. For example, lack of dietary fiber, low fluid intake, low calorie intake, you don't eat enough food. Yes, or other medications. Some medications have constipation as a side effect. Sometimes stress, anxiety, lack of sleep, other disorders such as metabolic disorders can also cause constipation. Yes. And there are also neurogenic bowel syndrome, where the nerves that have to do with the regulating passing of stool have been compromised because probably of surgery. Sometimes spinal cord injury can also cause that that malfunction of the neural system that is responsible for regulating bowel movements. Yes. So when you come to us, naturally we shall ask for a meticulous history. We shall ask you to tell us your medical history, your food history, also what you usually consume, because you're trying to rule out constipation that is caused by medication or other factors. So before anything, before we talk about anything, what we are going to recommend is that you include dietary fiber in your diet, you increase fluid intake, you include exercise, you live an active lifestyle. Yes, and also when the urge comes to defecate, please heed. Do not keep postponing. Also, there are what we call mild laxatives, such as sodium citrate, magnesium citrate. Excuse me. Yes, we recommend magnesium citrate, which is a mild laxative, and you use it once or twice. You do not use it all the time. Whenever you feel like I should use it, you use it. Yes. So if it persists, then there are other things that will be recommended, but you need to go to a health professional. Yes. So what's we discourage, I think I already mentioned that we discourage chronic use of laxatives. Yeah, however, the medical nutrition therapy includes adequate fluid, dietary fiber, yeah, both soluble and insoluble fiber. We recommend that you consume both soluble and insoluble fiber. Yes, because fiber increases colonic fecal fluid, which I think I already mentioned. Yes, so if you know that you have been straining during 25% of defecation in the past 3 months, you have been straining. By straining, you are using too much energy in more than 25% for the last 3 months. You are in need of health services. If you know that your stool is lumpy or hard, you need healthcare services. Also, if you have a sensation of incomplete evacuation, you feel like you do not empty the bowels when you go to a stool, you also need to seek medical attention. If you feel like there is obstruction, a sensation of blockage, you also need to seek medical assistance. Also, if you go to pass stool less than 3 times a week, you are constipated and you need to seek medical attention. Yes, so I think it has been coming out importantly that you need to have a high fiber diet, both to prevent constipation and to manage constipation. What is a high fiber diet? So in a high fiber diet, we are going to increase whole grain bread, cereals, whole grain. Yeah, when you talk about portion, you're not talking about this processed portion. When you talk about rice, you're not talking about this processed rice. Whole grain as it has come. Yeah, whole grain bread. So let us increase to 6 to 11 servings. I'm not going to go into details. When you come to us, we shall be able to guide you. Yes, you also have to increase vegetables, legumes, fruits, nuts, and seeds, because also these are sources of fiber. High fiber cereals. Yes, for women 25 grams and for men 38 grams, because our needs are different because of hormones and ability, body size, body functionality. Yes, also increase fluid consumption to 2 liters a day, water consumption or fluid consumption to 2 liters a day. Yes, so dietary fiber, as I think if you have been able to take note, is edible plant materials. They're edible plant materials, and they are able to increase the bulk of the stool because they cannot be digested by the enzymes. that are in your body, they cannot be digested in the gastrointestinal tract, so they remain there. It is important. We have soluble fiber, we also have insoluble fiber, but both of it is important in your diet, because soluble fiber forms a gel that aids digestion. It slows down digestion, yeah, such that now the food is moving, it is not being digested very quickly to like yeah. Insoluble fiber, it adds water to stool and it adds bulk. Yes, so we need to guard strongly against overconsumption. We know that too much of anything is bad. So excess fiber that is greater than 50 grams per day is not good, because it will cause flatulence due to fermentation. You know that in our gastrointestinal tract, which is that digestive tract, when you consume food, it goes into the esophagus, then the stomach, then the small intestines, the large, then down to the anus. That is now the gastrointestinal tract. We know that they have bacteria or colonic flora. Now those ones, they ferment the fiber. When it is too much, they can ferment it and they cause gas, which is what we mean when we say flatulence. Yes, so it will not be comfortable or good for you. Yes, so there are also fiber supplements that can be added to yogurt, to bran, to cereals, to certain even juices. So when you go to buy this thing, you can look out for some of these things. Yes, and another thing to note is that when you start on a high fiber diet, you need to ensure that you take fluid, such that it facilitates movement and it reduces gastric obstruction in the stomach, and fecal impaction. Sometimes it can be there and it is too much, yeah, and it is not moving, it is impacted, like your feces are impacted, or in the stomach the food cannot go because there is no fluid. It is not moving, there is no motility. Yeah, so you need to include fluid, otherwise constipation can be easily prevented, and when it happens, it can be managed unless there is an underlying condition. Yes, thank you so much for listening to me. Do not forget to like, subscribe, share. I hope this was helpful. Till next time.